Hi, my name's Dana Shingai and I'm going to be doing IV fluid and medication today. So I'm going to go ahead and gather all of my materials. I have both my IV tubing piggyback. I have my 250 mLs of sodium chloride, and I have my 100 ml of sodium chloride with the amoxicillin inside of it. So I'm going to go ahead and do my drip factors first. So I'm going to have, for the fluid, we have 150 mLs per hour. So we're going to take the 150 mLs over 60 minutes times 15 drops per ml, which would give us 2,250 over 60, making it equal to 37.5, which would round to 38 drops per minute, crossing off the both mLs and leaving us with drops over minute. Medications, we're going to have 250 milligrams of amoxicillin in 100 ml of normal saline over 15 minutes. So we're going to do the 15 drops over mLs again times the 100 mLs over 15 minutes, which would give us 1,500 drops over 15 minutes, which would make us have 100 drops per minute for the piggyback IV medication. All right, so these are ones we're going to be using. So I'm going to go ahead and verify my orders are correct with the patient's chart. I'm going to go ahead and ask for 2 identifiers from my patient, first and last name and date of birth. I'm going to do the 6 rights of medication, the right patient, right dose, right route, right time, right documentation, and right medication. I'm going to go ahead and ask if there's any allergies to medications. If there is, I'm going to verify. If there's is or not, I'm going to verify that in the patient's chart. So I'm going to go ahead and start. I'm going to go ahead and perform hand hygiene, and then I'm going to go ahead and put my gloves on. All right, so I'm going to go over the IV tubing first. We're going to start with the main IV tubing. So this one is going to be the spike end. This one remains sterile. Do not open this until you are ready to spike your bag. This is where the fluid is going to go through into the drip chamber. You are going to make sure that the drip chamber is halfway full with the fluid that you are putting into the patient, leaving enough room to be able to see that the drops going in. Also, this is where the air is going to stay in instead of going through the tube and into the patient. This is the clamp roller. This is where you're going to be controlling how many drops per minute you are inserting into the patient. So all the way down means you're not getting anything through this tube. All the way up means it's just going to free flow all the way down. All right. The Y site. This is where you're going to be inserting a medication or another fluid that you are going to be attaching to this IV. The adapter site, this is where it's going to be going into the patient. And same thing with our piggyback line. Spike end, keeping it sterile, not opening it until you're ready to spike your bag. Drip chamber, we're going to fill it halfway, making sure that we're able to see the drops coming in and making sure that there's air in there so that air can go into it instead of into the tube. Same thing with the roll clamp. All the way down means nothing is coming through. All the way up is going to let the fluid free flow through the tube, and you are going to be controlling the drips per minute in this roll. All right. So I'm going to go ahead and start with my normal saline. So I'm going to go ahead and take off the cover. I'm going to go ahead and take off the cover of the spike, and we're going to spike the bag. So pushing it all the way through. All right. So before you flip this, you want to make sure that this roll clamp is all the way down. Otherwise, all of the fluid that you have in this bag is just going to completely flow through and fill up your drip chamber. Okay. So we're going to go ahead and hang this one. This is going to be 30 inches above the IV site on the patient. All right. So we're going to go ahead and prime the tube. I'm just going to go ahead and take off the clamp or the adapter site tip We're gonna go ahead and squeeze this, making sure that we can fill it halfway and that we're able to see the drips. I'm gonna go ahead and prime the tube. I'm just gonna put this over a trash can and let it prime. All right, now that our tube is primed, we're gonna go ahead and do our drip factor. So this fluid would be 38 drops per minute. So we're gonna go ahead and count for a full minute and just count the drips that are going into the drip chamber. So. Alrighty, so that one is done. I'm gonna go ahead and put the adapter end back covered. We're gonna go ahead and just hold off on doing anything with this one. And now we are going to go ahead and spike our medication bag. So I'm gonna go ahead and take this one off. All right. I'm gonna go ahead and grab my tubing, take off the spike cover, and we're gonna go ahead and spike this one, pushing it all the way through. Alrighty. Same thing with this one. We're just gonna make sure that the roll clamp is all the way down before flipping it. This piggyback is going to hang higher than our actual fluid. So same thing with this one. We're gonna go ahead and squeeze the tube, making sure that we get it halfway full. All right, so now we're gonna take our other IV line. We're gonna take the Y port, we're gonna clean it with an alcohol wipe and letting it dry completely. All right, so once that's dry, we're gonna take our piggyback adapter end and we're going to attach it to our Y port. And screwing it in. All right, so now that this one's attached, we're gonna go ahead and prime this tube. Because this other line is clamped, we don't need to worry about anything coming out yet. So we're gonna go ahead and prime this tube, making sure that we get out all of the air bubbles. Alrighty, so now we're gonna go ahead and do our drops per minute. So this one will be 100 drops per minute. So we're gonna count for a full minute of 100 drops going into the drip chamber. All right. So 100 drops per minute. And now this can be attached to our patient and we can regulate the drops. All right. So now I'm going to go ahead and clean up all of my supplies. I'm going to go ahead and remove my gloves. I'm going to go ahead and perform hand hygiene, and I'm going to document what I had done.